হ্যালো এভরিওয়ান, আজকে আমার আলোচনার টপিক cerebellum. The cerebellum is situated in the posterior cranial fossa and is covered superiorly by the tentorium cerebelli. It is the largest part of the hindbrain and lies posterior to the fourth ventricle, the pons, and the medulla oblongata. It is connected to the posterior aspect of the brainstem by three symmetrical bundles of nerve fibers called the superior, medial, and inferior cerebellar peduncle. If a section made through the cerebellum parallel with the median plane, the cut surface has a branched appearance, called the arbor vitae. Cerebellum consists of two cerebellar hemispheres joined by a narrow median vermis. It has two surfaces, superior and inferior. A deep horizontal fissure lies along the margin of the cerebellum, which separates the superior surface from the inferior surface. Posteriorly, the hemispheres are separated by a deep vallecula. Cerebellum has three main functions. Number one, maintenance of posture and equilibrium or balance. Number two, maintenance of muscle tone. And number three, coordination and smoothing of voluntary motor activity. Now, the anatomical subdivisions of cerebellum: the anterior lobe, the middle or posterior lobe, and the folliculonodular lobe. Here we can see in the figure. The anterior lobe is separated from the middle lobe by a V-shaped fissure called the primary fissure. The middle lobe is the largest part of the cerebellum and is situated between the primary and uvulonodular fissure. Here we can see further subdivision of cerebellum. The vermis of cerebellum consists of lingula, central lobule, culmen, declive, folium, tuber, pyramid, uvula, and nodule. And the cerebellar hemisphere consists of ala, quadrate lobule, simple lobule, superior semilunar lobule, inferior semilunar lobule, biventral lobule, tonsil, and flocculus. Now the morphological subdivision of cerebellum. Number 1, archicerebellum or vestibulocerebellum. Number 2, paleocerebellum or spinocerebellum. And number 3, neocerebellum or pontocerebellum. Archicerebellum consists of flocculonodular lobe and lingula, and its function is posture and equilibrium of trunk muscle. Paleocerebellum consists of anterior lobe excluding lingula and pyramid and uvula, and its function is crude movement of limb. And neocerebellum consists of middle lobe excluding pyramid and uvula, and its function is smooth performance of highly skilled voluntary movement by coordination. Now the functional subdivision of cerebellum. There are three functional area or zone of cerebellar cortex. Number 1, vermal zone. It influences the movement of the long axis of the body, the neck, the shoulders, the thorax, and the abdomen and hips. Number 2, paravermal area or intermediate zone controls the muscle of distal part of the limb, the hands and feet. Number 3, lateral zone. It concerned with the planning of sequential movements of the entire body and is involved with the coordination and conscious assessment of movement errors. Now the structure of the cerebellum. The cerebellum is composed of an outer covering of gray matter called the cerebellar cortex, inner white matter, and masses of deep gray matter forming the intracerebellar nuclei which are embedded in the white matter. Structure of the cerebellar cortex. The cerebellar cortex can be regarded as a large sheet with folds. Each fold or folium contains a core of white matter covered superficially by gray matter. Here we can see in the figure the histological structure. Now the layers of the cerebellar cortex. An outer molecular layer containing stellate cells and basket cells, a middle Purkinje cell layer containing Purkinje cells, and an inner granular layer containing granule cells and Golgi cells. The Purkinje cells are Golgi type 1 neurons. Axons of the Purkinje cell enter into the white matter through the granular layer and terminate by synapsing with the intracerebellar nuclei. The three layers of the cerebellar cortex contain five types of neurons. Among them, four are inhibitory neurons. Only the granule cells are excitatory neurons. Now the intracerebellar nuclei. From lateral to medial, there are dentate nucleus, emboliform nucleus, globose nucleus, vestigial nucleus. The dentate nucleus is the largest of the cerebellar nuclei. It has the shape of crumpled bag with the opening facing medially. The interior of the bag is filled with the white matter made up of efferent fibers. The emboliform nucleus is ovoid in shape. The globose nucleus is rounded in shape. The vestigial nucleus lies near the midline in the vermis and close to the fourth ventricle. The intracerebellar nuclei are composed of large multipolar neurons. White matter of the cerebellum consists of three types of fibers. The intrinsic fibers. These fibers are confined in the cerebellum. They connect different regions of the cerebellum. Number two, the afferent fibers. They form the greater part of the white matter. They enter the cerebellum through the inferior and middle cerebellar peduncle. Number three, the efferent fibers. These fibers are the axon of Purkinje cells of the cerebellar cortex. Most of the Purkinje cell axons pass to and make synaptic contact with intracerebellar nuclei. The axons of the neurons then leave the cerebellum. A few Purkinje cell axons in the folliculonodular lobe and in parts the vermis bypass the cerebellar nuclei and leave the cerebellum without synapsing. Cerebellar efferent fibers from the cerebellar cortex. The cerebral cortex sends information to the cerebellum by three pathways. Number one, the cortico-pontocerebellar pathway through middle cerebellar peduncle. Number two, the cerebro-olivocerebellar pathway through inferior cerebellar peduncle. And number three, the cerebro-reticulocerebral pathway through middle and inferior cerebellar peduncle. Now, cerebellar efferent fibers from the spinal cord and internal ear. The spinal cord sends information to cerebellum from somatosensory receptor by three pathways. Number one, the anterior spinocerebellar tract through superior cerebellar peduncle. Number two, the posterior spinocerebellar tract through inferior cerebellar peduncle. Number three, the cuneo-cerebellar tract through inferior cerebellar peduncle. The vestibular nerve sends many afferent fibers to the cerebellum through the inferior cerebellar peduncle on the same site. All the afferent fibers from the inner ear terminate in the folliculonodular lobe. Cerebellar efferent fibers. The entire output of the cerebellar cortex is through the axons of the Purkinje cells. The efferent fibers from the cerebellum connect with the red nucleus, thalamus, vestibular complex, and reticular formation. Through superior cerebellar peduncle, globose emboliform rubral pathway, and dentato-thalamic pathway. Through inferior cerebellar peduncle, vestigial vestibular pathway, and vestigial reticular pathway. Here we can see in the figure. Now we will see the tracts at a glance. Through the superior cerebellar peduncle, afferent tracts are anterior spinocerebellar and tectocerebellar tract. Efferent tracts are cerebellorubral, dentato-thalamic, dentato-olivary, and vestigial-reticular tract. Through the middle cerebellar peduncle, only afferent tracts, pontocerebellar tract. Through the inferior cerebellar peduncle, afferent tracts are posterior spinocerebellar, cuneo-cerebellar, olivocerebellar, reticulocerebellar, and vestibulocerebellar tract. Efferent tracts are cerebellovestibular, cerebello-olivary, and cerebello-reticular tract. Now the cerebellar cortical mechanism. The clamping and mossy fibers are the two main line of input to the cerebellar cortex and are excitatory to the Purkinje cells. The clamping fibers are the terminal fiber of the olivocerebellar tract. They arise only from the inferior olivary nucleus. Each clamping fiber makes a large number of synaptic contact with the dendrites of the Purkinje cell. A single Purkinje cell makes synaptic contact with only one clamping fiber, but one clamping fiber makes contact with 1 to 10 Purkinje neurons. The clamping fibers terminate in the molecular layer by dividing repeatedly. The mossy fibers are the terminal fiber of all other cerebellar afferent tracts. A single mossy fiber may stimulate thousands of Purkinje cells through the granule cells. As the Purkinje cell are inhibitory neuron, inhibitory impulses are transmitted by the Purkinje cell to the intracerebellar nuclei. which in turn modify muscular activity through the motor control area of brainstem and cerebellar cortex. So it can be said that Purkinje cells form the center of the functional unit of the cerebellar cortex. The cerebellar glomerulus consists of postsynaptic granule cell dendrites and presynaptic terminals of mossy fibers. Here we can see in the figure. The output of the vermis projects to the fastigial nucleus, the intermediate region of the cortex projects to the globus and emboliform nuclei, and the output of the lateral part of the cerebellar hemisphere projects to the dentate nucleus. A few Purkinje cell axons pass directly out of the cerebellum and end on the lateral vestibular nucleus in the brainstem. In this respect, the cerebellum has no direct neuronal connection with the lower motor neurons but exerts its influence indirectly through the cerebral cortex and brainstem. The excitatory mossy fibers use glutamate and the excitatory clamping fibers use aspartate as the excitatory transmitter. All inhibitory neurons in the cerebellar cortex release GABA as inhibitory transmitter. Now the intracerebellar nuclear mechanism. The deep cerebellar nuclei receive afferent nervous information from two sources: the inhibitory axon from the Purkinje cell of the overlying cortex and the excitatory axon, the branches of the afferent clamping and mossy fibers that are passing to the overlying cortex. So after receiving excitatory information from the clamping and mossy fibers, the intracerebellar nuclei receive cortical processed inhibitory information from the Purkinje cells. Efferent information from the intracerebellar nuclei leaves the cerebellum for distribution to the other parts of the brain and the spinal cord. Blood supply of the cerebellum. Artery supply. Superior cerebellar artery, a branch of basilar artery, supplies the superior surface of the cerebellum. Anterior inferior cerebellar artery, a branch of basilar artery, supplies the anterior part of the inferior surface of the cerebellum. Posterior inferior cerebellar artery, a branch of vertebral artery, supplies the posterior part of the inferior surface of the cerebellum. Now the venous drainage. Veins drain into neighboring venous sinuses. Here you can see in the figure. Now the applied anatomy. Cerebellar lesions produced a number of signs and symptoms which are collectively known as cerebellar syndrome and are limited to the same side of the body. The signs and symptoms are the following: hypotonia, loss of muscle tone, postural changes and alteration of gait. The head is often rotated and flexed. The shoulder on the side of the lesion is lower than on the normal side. Ataxia, disturbance of voluntary movements. The muscle contract irregularly and weakly. When the patient is asked to touch the tip of the nose with the index finger, the finger either passes the nose or hits. Dysdiadokinesia, inability to perform alternating movements regularly and rapidly. Disturbance of reflexes. Nystagmus, disturbance of ocular movement, rhythmical oscillation of the eye. Dysarthria, disorder of speech, occurs due to ataxia of the muscle of the larynx. Speech tends to be explosive and the syllables often are slurred.